Assessing nerve root compression and thoracic outlet syndrome. We'll begin with one that's not too common. It's the intertransversarii muscles, shown in white here, as they run along either side of the bifurcated transverse processes. They're the first muscles that have the ability to compress the cervical nerve roots. So we're going to develop an assessment here. By having Keith rotate his head back and forth, I'm looking for the side that he turns easiest to. So he turns easiest to the right. I'm testing the right side now, the intertransversarii muscles on the right, by lifting his head gently to barrier. If he has symptoms down the right side, that's a positive for intertransversarii compression of the nerve roots on the right. I go to the left side. Notice how he can't turn as far to the left. Do the same thing, raise him up, see if he has any symptoms down the left side. If he doesn't have any symptoms down the left side, that's a negative, no problem. The next test, the interscalene triangle provocation test, we pull him off the table and we get this odd little grip. It's a football grip. You get your hand along the chin so that you can bring the head into extension. If breast tissue is an issue, use a small pillow. I'm extending his head. I'm side bending and rotating to see if I can get it to squeeze, the nerve roots to squeeze between these two anterior middle scalenes. So look at how I'm doing it. Right rotation, left side bending, and then the last thing is extension. And this is testing the right side, the interscalene triangle on the right side. So if he has symptoms on the right during that test, that's a positive. Now I'm going to do the same thing, compress a little bit, and then right side bend him, left rotate him, and it's the side you rotate to. So when I rotate him left, I'm testing the left side. If he's having symptoms down his left side, record that in your assessment sheet. First rib, look how this illustration shows the anterior and middle scalene pulling up that first rib and trapping the nerve between the clavicle and the first rib. So elevated first rib, we got to make sure that we can identify this. First of all, we just want to palpate for the bony margins of the superior border of the first rib and see if one feels higher than the other. If we're not sure, we ask them to take a big breath. And this is tricky. When they take a big breath, the one that's the problem does not move because it's already elevated. The other one will move up. So if he has a problem on the right, it's not moving up on the right. That's what you record. Number D is a modified Adson's test for brachial plexus compression. Notice between the anterior here and middle scalenes. Again, this is another test. We take them off the table into extension, left rotation, a little bit of side bending too, abduct the arm and have them completely internally and externally rotate that arm, particularly when they go into external rotation, and bring it into a little more left rotation, a little bit of extension. And if they're having symptoms down the right side, that's a positive for the Adson test.